Yes, we have data on about 21,000 home care clients with congestive heart failure, and we've been able to compare those individuals with home care clients in the general population, about 250,000 who do not have heart failure. And so first of all, what we found about them is that they're not particularly different in terms of their age distribution, their level of cognitive function. They're less likely to be female, more likely to be male. But we find that there's two relatively striking things from their health status. They're more disabled in terms of their ability to do activities of daily living like dressing themselves, climbing stairs, transferring from one surface to another. So they're more disabled, and they're also more medically complex. So they tend to have many more symptoms than the average home care client does. We also found that they're on many, many medications. If we take out the congestive heart failure medications they're on, compared to a generic home care client, they are more likely to be on 9 or more medications compared to others, excluding those heart failure medications. And the last point is that they're also very likely to have many, many other comorbid health conditions present. So when we think of somebody with congestive heart failure, we're really thinking of somebody who has heart failure and many other diseases present, diabetes, arthritis, many other comorbid conditions. So this is a population with very complex healthcare needs. Now, an interesting thing that we've been able to do as part of this study is to look at what their medications are that they're receiving. What we found, based on guidelines by one of our team members who's a geriatrician, George Heckman, who's on the National Committee setting guidelines for care around cardiovascular disease in the elderly, we were able to work with him and his colleagues to come up with recommendations of what would be ideal medication types. And the medications we're looking at are ACE inhibitors, angiotensin receptive blockers, and beta blockers. And what we found is that if we look at the ideal combination of medications that somebody with heart failure could be on, only about 28% of heart failure patients in home care are on the ideal medications. And we also found that almost 30% of home care clients are receiving none of those medications when they have heart failure. Really quite an astounding finding, given that these guidelines are reasonably well known. When we tried to understand, well, what predicts somebody not having these medications, we found that age was an important barrier. If somebody was over 85, they were much more likely to not be receiving any medications for heart failure. Disability, behavioral issues were also related to that. So a sense of frailty may be a barrier to putting in place appropriate treatment for heart failure. And some of these comorbid conditions were more likely to lead to no drugs being present, and others reduce that probability. So when there were comorbid conditions related to other symptoms of heart disease, they were more likely to receive some treatment. But if they had chronic obstructive pulmonary disease, they were less likely to receive treatment and more likely to receive no drugs. And that is based in part on some evidence around contraindications around COPD and use of those medications, but it's not as clear cut as that. And in fact, there's some suggestion that some of those patients could in fact be receiving the medications appropriately. The other thing that we found is some interesting dynamics with respect to where somebody is in the healthcare system. We found that if somebody has had their medications reviewed recently by a primary care physician, they're more likely with heart failure to be on the appropriate medications. So that's good. When a family doc reviews the meds for somebody with heart failure, they're more likely to get the right meds. That's reassuring. Also, if we look at home care clients who have been in the hospital recently that have heart failure, they're also more likely to be on the correct medications. So when somebody has a hospital stay, things are happening to improve prescribing. But what we found is that home care clients who have been in the emergency room were not any more likely to be on the appropriate meds than those who had not been. And so it seems that when elderly people with heart failure go to the emerge, we're not looking as closely as we might at what medications they're receiving for their heart failure.